Hello everyone, I welcome you all to this channel. Thank you for stopping by. Thank you all of our subscribers and all that always check on us. I appreciate you all for your efforts. This channel we give you varieties because we like to deal with varieties because life is all about varieties. All right. Today we are going to be discussing about depression. You know, we have experienced a lot of issues that have to do with depression, and many people are passing through a lot of things, and in some cases they do not know how to handle their issues. Today I'm bringing this little article and exposition I just prepared for us. So depression, we are going to be considering this. First of all, I would like to give you a little definition, or insight on depression. Depression is usually mood disorder that causes a continuously abiding feeling of sadness and loss of interest. In other words, you can say major depressive disorder. You can say that depression is a common and serious medical illness that negatively affects your feeling, thinking, and actions. Depression can lead to a variety of emotional and physical problems. You may have trouble doing normal activities you enjoy doing from day to day, and sometimes you may feel as if life isn't worth living. Yeah. It can lead to a variety of emotional and physical problems and can even decrease your ability to function at work, at school, or at home. So let's give a little highlight on depression. Being sad is not the same as having depression. In cases of losing a loved one, the grieving process is usually painful. We know, it's natural and unique to each individual. You share, some of the same features of depression. Though both grief and depression may involve intense sadness and withdrawal from usual activities, actually, yeah. But being sad is not just, same as having depression. But having said that, when you grieve, you often have feelings that come in waves, often intermixed with positive memories of the deceased. But in grief, self-esteem is usually maintained. You see, when you are grieving, it doesn't take away your self-esteem. It doesn't take away whom you are. Your internal being is still there. But when you're depressed, man, you feel as if you don't even own yourself. You see, you don't see your worth. You see yourself as worthless, as nothing. So this is some of the differences between being in grief or being sad, as often mix it with depression. Okay, we'll quickly take some highlights, some symptoms of depression. Okay, let's start with feelings of sadness, tearfulness, emptiness, or hopelessness. Yeah, this is one of the major symptoms of depression. And in this case, we could be as mild depression, but when it continues to increase, your symptoms will continue to enlarge. We have angry outbursts, irritability, or frustration, even over small issues. Some people, in their own cases, they have loss of interest or pleasure in most of all, or normal activities such as sex, hobbies, sports, and even normal eating of food. Feeling of worthlessness or guilt, fixating on past failures or self-blame. Some people have sleeping disturbances, including insomnia and or sleeping too much, rather, also. Experiencing lots of anxiety, agitation, or restlessness. You can be restless mentally, being restless physically. These are all symptoms of it. You have difficulty thinking, concentrating, making decisions, and loss of forgetfulness. At work, if you are depressed and you're at work, you in fact, sometimes you'll be finding yourself, because the things you ought to do, everything will be skipping, continue skipping. Okay, you have tiredness and loss of energy, in which cases even small tasks take extra effort for you to accomplish. Having reduced appetite and weight loss also increased longing for food and weight gain. Most times, it comes positively. In other experiences, it might come negatively. That is that. Okay, you have a slow thinking, speaking, or body movements. Yeah, it's as if you are moody. We have a frequent or periodical thoughts of death or suicide, or having a suicidal attempt. You are thinking your life is not worth living. You just want to die and end this whole shit. Most of the symptoms also include unexplainable physical problems such as back pain or headaches. There's this kind of continued headache all around their skull will be aching. Let's quickly look at factors that contribute in depression. We have the genetical factors. The genetical factors, we can say, is a natural phenomenon that you are born with. And we have biochemistry, which is differences in certain chemicals in the brain, which may contribute to symptoms of depression. And then we have the personality factors. This is one of the major causes. People with low self-esteem, who are easily overwhelmed by stress, or who are generally pessimistic, they said they appear to be more likely to experience depression. We have environmental factors. Environmental factors, continuous exposure to violence, neglect, abuse, or several kinds of poverty. This poverty makes some people more vulnerable to depression. And okay, let us take a quick look on these personality factors, most of which could come as bullying. Maybe at work you're being bullied, in your home, your marriage, your husband or your wife is a bully, or your children, one of your children, the grown children, is turned into a bully. Some people who might have experienced sexual assault, some people who have experienced tragic accidents, which got them overwhelmed that they couldn't control their thinking out of it. A lot of issues in life, a lot of things that could lead to a physical factor of depression. Moving into treatment of depression, let's follow the process. I will just take you through the process, but I would like to take the first one to be psycho or talk therapy. Psychotherapy or talk therapy. This has a lot of effect. It's often used alone for treatment of mild depression. In cases of moderate to severe depression, psychotherapy is often used along with antidepressant medications. In the treatment process of depression, cognitive behavioral therapy (CBT) have been discovered to be conducive in treating depression. CBT can be seen as a form of therapy which focuses on solving the now problems. What I always tell people around is, when you get into this mess or you get into that problem that is tending you to think negatively, to behave otherwise, to take the radical action of suicide or whichever, have you ever talked to someone about it? Have you ever discussed your issues with your family, if you don't have a family you trust, with your friends, if you don't have a friend you trust, even if you're a beggar, someone in your life must have shown you kindness before. If you're a religious person, go through your religious community. Around you, okay, if you are not religious, you have a neighbor. Speak around your neighbor. You don't trust your neighbor? Just look for your creator. Yes, I know you don't believe in God. Some people do not believe in God. For those who believe in God, pray to God. That is one of the fastest way to relieve yourself of depression. Look for group meetings. Look for counseling. Keeping quiet does not solve the problem. Silence does not solve the problem of depression. No. Don't say, let me keep managing. With time, it's going to change. That husband, that wife, that friend, that boyfriend, girlfriend that keeps molesting you, hyperbullying you, and you saying you will change, you will change. Okay, I agree, you will change, no issues. But how long has it been? 1 month, 2 months, 6 months, 1 year, no change. 1.5 years, no change. 2 years, no change. When is the change gonna come? Speak up. Speak up. Do not die in silence. Yeah. Okay, that is one. Then two, try to mingle. Do not stay alone. If you figure out that you are no longer the same as you ought to be, you are thinking too much. In fact, it's as if your whole self has left you. You are seeing yourself so empty. Do not stay alone. Most times you don't even want to talk to anyone, just like the symptoms we outlined earlier on. Look at something. Look for comedy to watch. Look for, if you're a book reader, look for books to read. If you know anything that can just take your mind off that thought at a moment, follow it up. In medical, they say that the brain chemistry may contribute to an individual's depression and may be considered and factored into their treatment. In such cases, antidepressants might be prescribed to help modify one's brain chemistry. Yeah, these medications are not sedatives or tranquilizers. They are also not habit-forming. So generally, antidepressant medications have no stimulating effect on people not experiencing depression. So medication can help. Talk to your doctor. Look, if you don't have any doctor, look for a nurse you trust. Look for a social health worker. Look for someone who can help. Then let's take a look into the next one. The next one is self-helping and coping. And I have used the other one to run around the self-helping and coping. Depression is a real illness and help is available. Don't think that no one can help you. It's because you have not reached out. With proper diagnosis and treatment, the vast majority of people in depression, with depression issues, will overcome it. Yeah. If you are experiencing symptoms of depression, the first step is to try to speak out. Like we just said, do not keep quiet. I'll say it again. Do not stay alone. Try to mingle. Someone must have helped you. The person will also help you again. Okay, we will look at the other one. The one we call ECT is electroconvulsive therapy. Electroconvulsive therapy is used often assisting with the medical treatment. It has been commonly reserved for patients with severe major depression who have not responded to other treatments. This is like a last option by then, but don't let your depression get to this extent, please, I beg you. So this one is used for people who are almost going crazy. Okay, so it involves a short electrical stimulation of the brain while the patient is under anesthesia. It is usually managed by a team of trained medical professionals, including a psychiatrist, anesthesiologist, and a nurse or physician assistant. Usually, a patient typically receives ECT 2 or 3 times a week for a total of 6 to 12 treatments. I'm not going to give you much of the theories. You might be, if you are too afraid, try to minimize your fear. Fear never leads or gives you any good solution. Minimize your fear. See the good in you. You think you are too inferior. No, it's simply because you have not seen someone who values your worth. You worth a lot. You worth more than you think. Begin to see yourself valuable, but don't be pompous, don't be proud. Yeah. Try to be truthful. Try to be plain. Have a pure life. Try to make peace with yourself and with people around. Any good thing that you think is good, reach out to it. You are going to get through it. Stay calm. Keep believing. Do not give up. Giving up has never been the solution. Thank you for tuning in. Hope to see you again. Remember to like, share,